Ben, the Trump administration has been really trying to get a handle on the coronavirus for months now. You had the opportunity to interview a key member of the White House task force, Dr. Deborah Birx. Did you learn or hear anything new from her today?
Yeah, John, Dr. Birx advises states like California, Florida, and even Texas that are seeing a bit of a spike in cases to put the brakes on reopening to stop the spread. COVID-19 is even surging through churches. The New York Times reports more than 650 coronavirus cases have been linked to 40 churches and even religious events across the U.S. Do you consider churches to be a source for spreading COVID-19?
Well, any gathering indoors is a potential spreading event, but there has to be virus there. If churches would move outside, which the weather is beautiful, and social distance outside, we know that that is much safer. If they would wear masks, we know that is much safer.
Now, President Trump declared churches an essential service as some places of worship embedded in these hot spots that John was talking about at the top of the show are closing their doors and turning to virtual services. States are seeing record high numbers each day, but the daily death toll for the country as a whole is trending downward. I asked Dr. Birx the reason behind the low mortality rate.
But we also have to remember that we've become better at treating individuals with COVID in the hospitals. And so we don't expect the same level of what we call mortality or case fatality rates that we saw in March and April, because we have more therapeutics, we have better ability to treat individual patients, and we know a lot more about what works, from the steroids once you're on a ventilator all the way back to remdesivir as soon as you start to have problems with breathing and what we call decreasing oxygen saturation.
And to build off what Dr. Birx was talking about, the U.S. is doing 600,000 COVID-19 tests a day. And for the first time, she said, they are able to see the full spectrum of the disease. They report those numbers to the coronavirus task force, which she is on, and that information gets passed up to the top. Do you have regular contact with President Trump and brief him on the latest?
I have regular contact with Vice President Pence, and certainly up through the leadership to President Trump. I provide data daily up through my chain so that they know exactly what's going on state by state, county by county, metro by metro, so that everybody's informed and everybody has the same information.
A key piece of information is on vaccines. Dr. Birx told me that 3 vaccine candidates are in the last stages of the trial. They've already begun making doses, so in the event that one turns out to be safe and effective, it's already being mass produced and ready to use and distributed to the most at risk.